cat scratch disease is actually caused by a bacteria called Bartonella Hensley. It's generally something benign and self-resolving. Rarely it can be what we call disseminated, meaning it involves more than just the lymph nodes. It can actually be very serious. You can have kids who get osteomyelitis or infection of the bone. You can get encephalitis, which can cause seizures and coma. You can even get blindness from this. Because it's so rare, it's really hard to pinpoint the incidence, and then it's really hard to give recommendations about workup, treatment duration, and which treatment you would actually choose. So we conducted a chart review over an 8-year period of pediatric patients at Kapi'olani Hospital to see if we could see an overall trend. What did people choose in their treatment? How long did they treat for? Can we characterize the illness anymore so that maybe it can be diagnosed sooner? How should we diagnose it? Because there's a variety of tests and imaging that you can use. So we're hoping ultimately that we can give some sort of guidance to clinicians going forward, because it is very rare relative to other pathology that we see.
It's rare and yet more frequent.
Yes, it's more frequent in Hawaii. Yes, okay, that's fine. Yeah, so we actually looked at the incidence. In the US, sometimes it's quoted as being as rare as 0.19 per 100,000 cases. In our data, looking at the US Census for how many pediatric kids we have in Hawaii, we think it's almost 2.5 times more common here in Hawaii than it is nationally.
Speculation?
I think we have a higher incident of the bacteria in our kitten and cat population in Hawaii. Why exactly, I'm not quite sure.
And how do you get
cat? Oh yes, so cat scratch disease is appropriately named. You get it from cats. Oftentimes kittens have a higher level of the bacteria, and it's spread between cats by fleas. So one way to hopefully prevent this and not get it is to make sure you're trying to control the flea population, especially with your cats, maybe avoiding wild cats, which oftentimes have higher flea incidence.
What's the next step for this?
Next step. Okay. Well, it is a case series. We only actually had about 20 cases that we looked at. More data is always better. So there's always the possibility of joining with the Children's Hospital on the mainland. It might not be as frequent there, but they might have actually more pediatric cases, so they can get numbers that we can combine and look at things. I think when you have a larger number of cases, you can better give recommendations confidently.
And the bottom line is better treatment?
That's my hope, is to find out a way that we can definitively treat and work up so that we avoid the unnecessary tests that often go with this. A lot of times you present with a prolonged fever, people get really nervous. They're doing a bunch of different workup trying to figure out what's going on, and that's a lot of tests. That's a longer stay in the hospital. So if we can get good diagnostic testing and we can start treatment earlier, maybe we can avoid some of the expense and emotional stress for families. Sure. So I worked on this project with Dr. Natasha Ching. She's one of the pediatric infectious disease doctors in Hawaii. And she seems to think this suggests that maybe we should consider it sooner on our differential. Rather than waiting for 14 days of fever for a long period of time, if we consider this sooner because it's a higher incident in Hawaii, that might be more judicious or beneficial. So maybe working it up a little bit sooner and starting to get the serologies before the 14 days of fever.